I'll explain first. The 211 leadership is really our local 211 San Diego. I know you guys probably all have 211s in your counties. And in San Diego, we were one of the first ones actually to get that started. And there was 4 of us sitting around the table with a dream. It was right after 9/11 where there was a 211 system in Atlanta. So that's what that was really about, is our 211 is a wonderful program, but I know you guys all have great programs. So again, I'm George Scolari. I work for one of San Diego's Medi-Cal Managed Care Plans called Community Health Group. I actually feel like I work for Healthy San Diego, and my real title is Behavioral Health Work Group Chair. And I'm going to talk mostly about Healthy San Diego today, and that's our model for Medi-Cal Managed Care in San Diego. Focusing on behavioral health, and I think the message I'm trying to get across is collaboration. We've been collaborating with our county behavioral health system forever, which you'll see on the slides and stuff. So I think you'll learn what our model is, which is a little bit different. There's 3 different models of Medi-Cal Managed Care in California. One is what's called geographic managed care, which is San Diego's model. That's where there's multiple health plans sort of competing with each other, but in San Diego it's hard to call it that because we're like with each other every day and partners. And then there's the county operated health systems and in some counties, and then there's 2 plan models where there's a county run health plan and then 1 competing plan that may have other plans built within it. So there's different models. San Diego's was called geographic managed care. And I can't go without introducing our leader of Healthy San Diego, who happens to be here, which is Peter Shee. Just wave your hands or say hi in case anybody has questions about our Healthy San Diego model. In the big picture beyond just behavioral health, Peter can help myself and Dr. Greenwood, and we have a few other people here you might meet from San Diego County. So moving on. So Healthy San Diego. Healthy San Diego kind of started, the dream was back in 1994, and the state of California, working with Department of Mental Health at the time, was talking about what they called mental health consolidation. They wanted to move all the mental health dollars a certain direction. So back in those early days before 1998, mental health services for people on a Medi-Cal Managed Care Plan was actually covered by the Managed Care Plan, regardless if somebody was mild to moderate, regardless if they were severe, if they needed inpatient treatment, whatever. We covered our own mental health services, and I worked for my company at that time. So, you know, at my company, at Community Health Group, we didn't really want to have a bunch of different providers all over the place, and we were a very small health plan back then, 30,000 members. We're now at 200,000 members for Medi-Cal. And we tried to model things after sort of kind of like Kaiser, where all of our psychiatrists and therapists actually worked for us under my direction. And we set up, which is really cool after that presentation we just saw. I really love that. But we set up offices for mental health services within federally qualified health centers for the most part. We had like 7 different offices around San Diego County, and the CEOs at these facilities, when I approached them saying, hey, could you give me an exam room 1 day a week or 2 days a week? It's like, well, sure, we'd love to have behavioral health services on site. And I'm like, this is good, but it's only going to be for my community health group members. And that kind of posed some problems, but they still loved it. It worked out for many, many years. So that was a nice model. And then in 1994, the state, mostly Department of Mental Health, but also Department of Health Services at the time, DHS, which is now called DHCS, decided they're going to consolidate things. So 1994 county behavioral health systems, they sort of had to create a mental health plan within each county and be responsible for certain services, primarily inpatient treatment. And then by July of 1998, they took over the county behavioral health programs. They took over covering all mental health services for Medi-Cal members, regardless of if you were on a Medi-Cal Managed Care Plan or not. Not everybody was on Medi-Cal Managed Care Plans back then. So each county basically created a mental health plan serving, for specialty mental health services, not mental health services treated within the primary care. So through that process, Healthy San Diego really flourished. It's a collaborative of all the health plans in San Diego. Our 5 health plans, our Community Health Group, Care First, HealthNet, Molina, and Kaiser Permanente. Kaiser, HealthNet, and Community Health Group are founding members of Healthy San Diego. Molina and Care First are our newest partners, but they've been around for years already. So we've been pretty steady for a long time. Our partners include advocates. We actually formed our health advocacy agency in San Diego. It's called Consumer Center for Health Education Advocacy. That was formed under the Healthy San Diego umbrella. We set up a work group that met for over a year just to develop this, even come up with the name Consumer Center for Health Education Advocacy. It's run by our Legal Aid Society, and all counties have a similar program like that. That would be where somebody receiving specialty mental health services wanted to file some kind of grievance or complaint. That would be the agency in San Diego they would go to. Our partners also include the school systems, foster care, federally qualified health centers, private providers, you name it, we have them at the table. And we have what's called our Joint Professional and Consumer Advisory Committee, which underneath that has a Quality Improvement Subcommittee, and underneath that has probably 9 different work groups. I'm talking about just one, our Behavioral Health Work Group. Behavioral Health Work Group actually has, at this point, I think 84 members, so everybody's on it. All of our county behavioral health programs have somebody represented there. We have folks from mental health systems here, Dave Kahn. We have a lot of providers, psychiatrists, psychiatric hospitals at the table. It's really become quite a big group, and we have been meeting since 1998. So again, the whole thing that I'm talking about today is the importance of collaboration. When mental health services was carved out in July of 1998 of Medi-Cal Managed Care Plans, we had like probably 2 years to get ready for it, so we were meeting on a regular basis. And the last year we were meeting every single Friday for 8 hours for 6 months straight, getting ready to transition these members. It was a small amount of people at that time compared to now, especially compared to what we just went through in January with this new benefit for the mild to moderate, which I'll talk about in a little bit. So again, specialty mental health services was carved out of Medi-Cal Managed Care in July of 1998. That's when we formed our Healthy San Diego Behavioral Health Work Group. One of the first things we did with that work group was really focus on medications. We were worried about people getting medications prescribed by non-health plan providers. When specialty mental health was carved out of Medi-Cal Managed Care Plans in 1998, so were certain medications, basically the mood stabilizers, the antipsychotics. I think it was really assumed that the health plan's primary care providers aren't likely going to be prescribing risperidol and Seroquel and those types of drugs. Therefore, the health plans wouldn't cover those particular medications. So they're still covered, they're just paid for by the state of California fee-for-service. What that means is if I have a community health group member that goes to a pharmacy, and I'm not a psychiatrist, so I'll say this wrong maybe, I know there's some psychiatrists in here, but say they have a prescription for Prozac and risperidol, the pharmacist will run that electronically. They'll type in Prozac, bill community health group, they'll type in Seroquel or risperidol, bill the state of California. It gets paid automatically, everything works. But in July of 1998, we weren't so sure about that, and it didn't happen. So right away, people were going to the pharmacies, get their medications. It would be an antipsychotic. They would try to bill the health plan, and the health plan would deny it because it's not a covered benefit, and the person would walk away without antipsychotic drugs. So we put together a really nice pharmacy card that had all the health plan contacts on it, who to call, specifically said how to run these prescriptions, and don't let anybody walk out the door without their medications. And then from there, we went to do a lot of other things, including the coordination of care form, which I'll talk about in a little bit. So coordination of care. One of the biggest problems when you have separate systems like this is coordinating care. How do you coordinate care? I'll give a little story for my health plan with the recent Healthy Families program, where we covered basically all the mental health services. There was no such thing as one of our Healthy Family kids going to see a psychiatrist or a therapist without the primary care doctor knowing pretty much everything that's going on, at least what they need to know. We do it at my place, we do it just when we authorize services. That authorization didn't just go to the requesting therapist or psychiatrist, it also went to the primary care doctor, and there'd be a summary on there saying, patient has seen so-and-so for therapy once a week for depression, and also seen, doctor whatever, psychiatrist for medications, and is on Prozac. And they had each other's phone numbers, they had a tool to communicate with each other, and they could talk. With specialty mental health services being carved out in 1998, and the counties now paying for those services, it meant our health plan members were getting treatment somewhere else. There was no mandate. Nobody had to do anything as far as coordinate care because health plans had no control or power over the county behavioral systems and vice versa. So there was lack of coordination. There was very, very little coordination going on. And if you can imagine somebody's on lithium or something, and then they go to a primary care doctor and they're given a bunch of Xanax and other things, those medications can clash. A few years ago, we heard of a patient who actually died because of that, where the primary care doctor specifically asked, as we investigated investigated things. Are you on any medications that I need to know about, blah, blah, blah. And the patient said, no, I'm not. They asked specifically, are you on any mental health medications? The patient said no, but she or he was on lithium, and there was an interaction. This person died. So having a system where you know who's prescribing what, that's pretty important. Behavioral health conferences in 2000, to address everything that I just said, we put on a couple conferences. First was in 2000, then we repeated it in 2005 because everybody kept talking about that 2000 conference within our San Diego County, both on the behavioral health side and the health plan side. We were lucky enough in those days to get pharmaceuticals to step up to the plate. They liked when we could get psychiatrists and primary care doctors all in one place. So we put on a conference, a care coordination conference in collaboration with our county behavioral health and county partners in other areas. And we had 310, it was really weird, we had 310 providers attend each of these conferences. And each of these conferences were held on the same day, just in a different year. It was just really weird how it turned out, the exact same amount of people. We had a lot of psychiatrists, we had a lot of therapists, a lot of primary care doctors, nurses, even some consumers show up. And the real message on that conference was about coordinating care, coming up with tools, any tools. We provided them with our coordination of care form that we developed in San Diego. We actually kind of copied what they were doing out of LA at the time and took that form and expanded it and did everything we could to encourage people, keyword encourage people, to coordinate care. But encouraging doesn't go very far when primary care doctors and psychiatrists and therapists are very, very, very busy. And really, there's been very limited coordination of care between physical and behavioral health providers in the Medi-Cal world. What was really, really cool last year is I went to the California Behavioral Health Directors Association meeting on behalf of San Diego County's Behavioral Health Director, Alfredo. He wanted us to present something, I think it was on healthy families at the time, and I was with one of his executives. And through that plane ride and talking about this problem, a decision was made that the county is just going to start requiring their county behavioral health providers to fill out this coordination of care form, and they're going to be monitored on it. And that began January last year, and we've been watching it. And for the first time since 1998, we're actually coordinating care in San Diego County for Medi-Cal beneficiaries. And it's mandated. And it's been really sad for all these years because when I've been speaking like this, I've always said, we don't want to force anybody to do something. You should do it because it's the right thing to do. But that never worked. So now it's working. You can tell I'm frustrated over that. Now it's working because the county stepped up and said you had to do it. But this is really good news as we start talking about Cal MediConnect and other things, because we've used that requirement to make it much easier from a health plan perspective for the county behavioral health providers to take care of our Cal MediConnect members. I'm going to shift around a little bit and just talk about some of the cool things we've done in San Diego. So I'll talk a little bit about healthy families and the new mild to moderate. I'll touch base on ABA because I had a lot of questions out during the breakfast time about ABA. And then the future of where we're all going and stuff as far as working together. I'll try to touch base on that. It might not flow very well, but you're all smart people. I know it'll be fine. Healthy families transition to Medi-Cal. That was a really, really hard one for many of us. The healthy families kids, for the most part, were a little bit different. Socioeconomic, all those issues were a little bit different. They were basically, 95% a really good population that had mental health issues and substance abuse issues, and health plans through our private networks of providers could do an outstanding job at taking care of those issues. They would get in with therapists. There was no questions asked, at least in San Diego. There was no major gatekeepers. You'd call our different healthy family programs. We each had our different ways of having networks developed and stuff, but people got the care they got. So all of a sudden, the state of California decided that they're going to get rid of the Healthy Families program and move all those members. In San Diego, there was about 88,000 healthy family kids. They were going to move all those kids into the Medi-Cal Managed Care Plans. So if there's a message here as we talk through this conversation, let's remember how they keep moving stuff into Medi-Cal Managed Care. It sort of is a theme. It's a theme to think about, because I think if you're a county behavioral health program, I could be wrong, but I believe within the next 2 to 5 years, everybody you see will be on a Medi-Cal Managed Care Plan. And that tells you we probably better have this really tight relationship in every county in California definitely the way I believe we have in San Diego. We've got no concerns about that. So we had to start moving these kids into the county mental health programs. And we were really, really concerned because we went through this, many of us at the table within our Healthy San Diego Behavioral Health Work Group, we're there during 1998 when we had to transition the Medi-Cal kids and adults receiving behavioral health services to the county when the county created their mental health plan like the other counties. So we worked and really focused on this. Prior to that, we had been having all of our meetings focused on this dream called Cal MediConnect, but we kind of said, hold that off a little bit for a few months. Let's deal with the Healthy Families transition to Medi-Cal. And we had about 2,000 to 3,000 kids receiving mental health services through our different health plans. We had 5 different Healthy Family programs, health plans in San Diego County. And we had to shift all those to the county mental health provider. And of course, county mental health providers, often depending on what part of San Diego County, they could have a 3 to 6 month waiting list as it is. The idea of taking that many kids into this other system, never mind cutting them off from these private providers, just didn't make sense. And then if you start thinking about the fact that these are not chronic, seriously emotionally disturbed kids necessarily, there was a separate system set up for those kids, which was only 3 to 5% of them. Where the counties took care of them. All that worked great for us in San Diego for many, many years. These are kids with, more or less limited problems or stable on medications and who could be transitioned fairly quickly to a pediatrician to take care of their Ritalin or Cylert or other types of drugs and stuff. So we, during our meetings, talked to our county behavioral health director and his executive team and came up with this idea. It's like, well, why would you want to take on all these people? You don't have room for them. You've got waiting lists as it is, and we know you try not to have these waiting lists, but the fact is there is a problem there. And they're like, geez, you're right. So we decided that they would just take over paying our providers to treat these kids. And we really said, why don't you just pay for them? It's kind of like continuity of care rules. Why don't you just pay for them to see one of our providers for 3 or 4 visits, just to either decide, can you transition out of treatment, because again, these are not serious mental health problems, or do they need to be transitioned to a higher level like a county organizational clinic and stuff. And so, it was agreed just like that that's how we're going to manage this. And Alfredo Aguirre, our behavioral health director, said, well, we're not going to do 3 or 4 visits. We're going to approve up to 13. So actually these kids, some of them had been in treatment for months, if not a couple years. And so they got an extra 13 visits. And from what we know, most of them did not need to be transitioned into a county system. They really wrapped up their treatment and they knew what to do if problems arise and they need to get referred again. And we have not had a single issue or complaint in San Diego about that transition, and we're very, very proud about that. So, low-income health program. You guys all know what the LIP is, low-income health program. I think most county behavioral health providers provided some form of LIP treatment. That low-income health program was the program to serve folks that didn't qualify for Medi-Cal or any other insurance, sort of like county medical services, but much better coverage. We had a great program in San Diego County. Again, my friend Peter Sheaf from Healthy San Diego oversaw that program. They did a huge amount of work. Really, a lot of time was spent on mental health. A lot of people think mental health is never, or substance abuse isn't looked at that closely. It's kind of the stepchild of healthcare. Well, it wasn't in our local low-income health program in San Diego County. And I'm really proud of the program that they set up. But the state of California decided that program's going away. Here's that theme again. Like Healthy Families, things are going away and things are going into Medi-Cal Managed Care, and those members would be transitioned to Medi-Cal Managed Care Plans. And there's a lot of good in that because Medi-Cal Managed Care Plans cover a lot of services. It was hard on us because with low-income health program, like every other county, these are folks who pretty much all have a lot of medical and mental health needs. It's not like our health plan. I talked earlier about my health plan has 200,000 members. Well, most of them don't have, there's a lot of 3- and 4-year-olds healthy people in there. So, there's that small group with some major issues, whether it's physical or mental health. In the case of, and then that huge group of people with very limited problems, it all balances out when you start not having to spend money here, but you have huge costs over here. With the low-income health program, they were all very, very sick, and they all got transitioned. I think it was something like, Peter, 50,000 members for San Diego County suddenly had benefits through our health plan. So we had to really work to make sure that they were able to get the care they need, because during that same time was the new mild to moderate mental health benefits coming into the Medi-Cal Managed Care Plans, which we'll talk about next. But so we were at the exact same time suddenly coming up with this new mental health benefit. And luckily for San Diego County, the way our low-income health program worked was their mental health services were primarily provided in two different ways, either at a county behavioral health services owned or operated mental health program, which I think there's 3 of them in San Diego County, or they were one of the county organizational providers like you guys, many of you in the room. So they either went to the county system there, or within our federally qualified health centers, several of them, I think 10 to 15 of them have wonderful behavioral health programs. They were receiving services over there, and the county LIP program, low-income health program, was paying for that treatment in either of those 2 settings. Well, what we did was we really looked at the health plans have arrangements or would make arrangements with those federally qualified health centers to pay for those and continue paying for them to continue the treatment they need. So there was no interruption in care. And basically the ones that were going to the county organizational providers or the county operated and owned programs would be the responsibility of the county mental health, because in order to get into those services, basically you go through that lengthy assessment process and you're certified as having a serious mental illness. And the health plans, remember, the new benefit was for a mild to moderate mental health condition, not a serious mental health condition. So to date, we really have not had any issues there. There was some hiccups. That unfortunate, I think not a lot, isolated cases with people getting their medications because of a new system, or the medications they were on through the low-income health program, weren't on the health plan's formulary. But that all got worked out pretty early, and we haven't really had a lot of areas that we've struggled with on that. So CCI, my favorite subject. Everybody knows what the Cal MediConnect program is. I think it's not in all counties, but it's in 8 counties, or it will be in 8 counties. It's approved for 8 counties. And if you're in a county where you're not doing Cal MediConnect, you probably will down the road, so you might just as well hear a little bit about it. It's really cool. It's part of the state's coordinated care initiative, which has 2 different components. So you don't want to get too confused over the CCI Coordinated Care Initiative and Cal MediConnect. Basically, the Coordinated Care Initiative is the big umbrella. And it's a big state program to really bring all services together. It goes back to that theme where everything's coming into Medi-Cal Managed Care. That is part of the Coordinated Care Initiative. Coordinated Care Initiative isn't all about dual eligibles. Underneath the Coordinated Care Initiative is a program called Cal MediConnect, which is to bring everybody who has full scope Medicare and Medi-Cal services into a managed care plan. And in San Diego, we have 4 health plans, not the 5 we have on Medi-Cal. We have 4 of those 5 actually. So it's Care First Community Health Group, HealthNet and Lena are Cal MediConnect plans. And very early on when this dream started with the state, our Healthy San Diego Behavioral Health Work Group started looking at how are we going to coordinate services. The health plans traditionally are not used to working with county organizational providers. It's a whole different world. I mean, what we've learned is just amazing, but it's such a different world. And just as important or more important is county mental health providers, county behavioral health providers these days, we'll call them, are not used to working with managed care plans whatsoever. They're not used to looking at our contracts that are this thick. They're not looking at our credentialing packets that are about that thick. It's really a challenge for them. So we did a lot of things, and hopefully you guys all got some handouts. And if not, they're up on a table up front. There's some mostly yellow ones, and the one I'm talking about right now, if you have them, is the blue one. Looks like this, Cal MediConnect, and they're at the end of the slide. And I'll go over it now instead of the end, actually. Basically, what we did was put together this form, to kind of give the county mental health programs a way of contacting the health plans, a little brief understanding of what the benefits are, which is on the back side, and who pays for what. And basically in Cal MediConnect, you're going to have one card if you join Cal MediConnect. You're going to get all your benefits coordinated like you've never seen before, along with a lot of additional visits, or additional benefits. So there's things in Cal MediConnect health plans have never paid for, but this also applies for Medi-Cal too. It's things like in-home supportive services. Those are all becoming health plan benefits. The state, back to that theme, they're moving everything into Medi-Cal Managed Care. Whether we want it or not, it's happening. The county's multi-service senior program, the former adult day health cares. A lot of adult day health cares had mental health programs in them. We have some of them that have half their population as mental health, and county mental health programs tend to refer to them. All those things have become benefits of Medi-Cal Managed Care Plans, which is part of Cal MediConnect. So if you look on the back side of this, under the Cal MediConnect program, there was like a 4 or 6 page document from Department of Healthcare Services that explained who pays for what under Cal MediConnect. So we created our little grid here, that hopefully made it a lot easier. Well, in San Diego, we know it made it a lot easier because we did so many trainings. But, for the most part, the Medicare benefit on the right, that would be the health plan. So if you're looking at this, if you have this in your hands, and I see most of you do, the part that says Managed Care Plan for San Diego would be Care First Community Health Group, HealthNet, and Molina. Those are the things we will pay for, which is almost everything. If somebody needs to be in a hospital, psychiatric hospital, never mind medical, but we're just talking psych. If somebody needs to be in a psych hospital, somebody needs to see a psychiatrist, somebody needs to see a therapist, the medications, all that kind of stuff is covered by us. And then on the left side is those things that are not covered by Medicare. So the counties, through the county contracts, the county behavioral services contracts, they continue to provide all the services they do. They just bill the county. They still get paid by the county for those things like crisis intervention, case management, payer service, the conservatorship stuff, IMDs, the long-term custodial care, clubhouses. I'm sure we all have wonderful clubhouses. We have the greatest in San Diego ever. So all those things are still covered by the county. Now they're coming together as one thing. And every single person on Cal MediConnect has what's called an individual plan of care. And the services on the left side of this document that the county is providing, including those on the right side that the county is still providing but the health plan is paying for, they all get embedded in this individual plan of care. So everybody knows what's going on, who to call. The idea is that county behavioral health providers will also know about all the medical stuff going on. They'll be invited to participate in the health plan's ICT, interdisciplinary care team. Every member has an ICT. It's required for us that we're going to invite county behavioral health to participate in these, and recently my health plan did that with one of our members that was placed in our only long-term care facility, Alpine Special Treatment Center. At the time, we now have a second one. But it's going really, really well. It's the beginning. It's new. It's going to take time, but it is going pretty well. So we developed our guide. We also, one of the requirements of Cal MediConnect was to have 6 joint policy and procedures about dispute resolution. If they come up in San Diego, we think we won't have dispute and resolutions, but you never know. So we created those. We created those very early on. We had to have an amendment or a new MOU. That goes back to Medi-Cal being carved out in 1998, where everybody had to sign an MOU with the county behavioral health between the behavioral health programs and the health plans. So we either had to amend that document or create a new one, whatever. And so we did a new document here, and we were the first one in California to actually get this through our Board of Supervisors and turned into the state of California. And health plans were regulated very heavily, but we tell the state, hey, we don't want to be sending you 4 different documents here. We want to do it one. We want to turn things in together, and that's what we did. As a group, as our Healthy San Diego Behavioral Health Work Group, we packaged our 4 documents that had county signatures on it and our health plan CEO signatures on it, and we submitted it all together. What I think was really cool, let me check time, okay, we're okay. What I think was really cool is presentations. We wanted to do what I just did, but much longer and much more detailed, is how are we going to work together, and how can these 4 different health plans really get to know our county behavioral health providers? So we started attending their meetings, and a lot of times it would be myself representing our plans, because I typically, until today, I never say the name of my company. I always say our health plans, because we are like one, and I think I work for them. They're all here in the room today. So we go to all the county behavioral health meetings. They have monthly meetings. They're done by regions, and some of them are just for substance abuse. And we're part of that and often on the agenda and do presentations, go over this form, go over everything we need to be able to coordinate care. So by the time Cal MediConnect started in May primarily, it started a little bit in April, but when it really started moving in May, these programs knew us. In fact, on February 25th, we decided to do a kickoff event. We felt like, okay, we've done something like 60 trainings to county behavioral health providers over the year and a half before. But so we've done all that. They know who we are. They've met all of us in person. You know, we like working with each other. We're looking forward to it, but let's do a kickoff event. So, you know, we had more there, you know, the heads of these programs attend this program so that they could take information back to their county behavioral health contracted agencies. And we had 150 people show up. And then that led to more questions, and a week later we had to pull them all back together and answer some more things. But it's what they wanted. I remember being asked this. I'm like, why do we have to do it again? And all of my health plan says, because they asked. That's what we did. So things have gone very well in Cal MediConnect. It's new, it's starting. It will take some time. So moving on to, or back to, Medi-Cal Managed Care Expanded Mental Health. When we were busy and we weren't looking, the state of California decided to give us a new benefit. You know, I earlier talked about in-home supportive services coming into our health plan, multi-service senior program coming into our health plan, community-based adult services coming into our program, Medi-Cal Managed Care programs. And the latest one as of last Monday is applied behavioral analysis for folks with autism spectrum disorder. I can touch on that. It's not on a slide. It's consuming our time right now. You know, so the other thing that kind of threw us off was, you know, mental health, especially mental health services, was carved out of our health plans back in July of 1998. From that time on, we had covered no specialty mental health. No Medi-Cal Managed Care Plan had a single mental health provider for their Medi-Cal line of business. Specialty mental health was covered by the county behavioral health programs through the mental health plans, as you all know. Health plans covered a huge amount of mental health services, which was a kid going to a pediatrician and getting their Cylert or Adderall, or an adult going and getting their Prozac, et cetera. That was the extent of coverage and stuff. And the state of California decided, hopefully you guys all know why, but it really had to do with the fact that with the Affordable Care Act, there's a whole bunch more people getting Medi-Cal Managed Care, qualifying for the first time. It used to be poor, disabled, including psychiatric disabilities, or somebody single parent with a bunch of kids on welfare. That was our population. And in fact, until a few years ago, our mandatory population being enrolled in Medi-Cal Managed Care, you know, was primarily only the folks on welfare. So 80% of our membership typically were under the age of 18. Mom or single dad with a bunch of kids. All of a sudden now we've got all these elderly folks and disabled folks and some of this newer population. So I told you how the state's moved the low-income health program, 50,000 people into our Medi-Cal Managed Care programs. Just recently, the state has, they moved all the healthy family kids, 88,000 kids went over, and then at the same time with the new Affordable Care Act and people now qualifying, if you're a single person and you're working and you only make up to a certain money, you don't have to be on welfare with kids and you don't have to be disabled, you can actually qualify for Medi-Cal. And so we've got all this population coming into Medi-Cal Managed Care Plans. I mean, my company's grown, doubled basically in a year. You know, Saber from Molina's here and Care First, everybody, my partners are here. I know HealthNet, Steve's back here somewhere. You know, many of us have had to move into new offices, for sure find bigger parking lots. You know, we can put people on top of each other, but you got to park a car. And so we've all been struggling with all this recently, with all this new membership. And when you think about this new population, especially the working adults that are only making a certain amount of money, that don't necessarily have other insurance and they can now get Medi-Cal, they don't have a lot of serious mental health conditions all the time. And there's nowhere for them to go to get the care they need because they're, in the state's mind, they're not going to qualify for mental health care through a county agency. I never believed that in San Diego County because, you know, over the years I've just watched, especially our kids and stuff on Medi-Cal years and years back, it's not like they had to be making suicide attempts to get care. Anybody that wanted care was going to get some care in our wonderful county behavioral health programs. In San Diego, I don't know how it is around the rest of the state, but I think everything else is pretty much the same. But in the state's minds, it's like you had to be really, really sick to get care if you have Medi-Cal for mental health. So they've decided we're going to have this new benefit for Medi-Cal Managed Care Plans to cover for anybody with a mild to moderate mental health condition. One of the first things we did was, again, if you've got the handouts, the yellow one that says Medi-Cal Behavioral Health Quick Guide, it lists our 5 different health plans: Care First, Community Health Group, Health Net, Kaiser and Molina Healthcare. It lists our different mental health programs, who to call. It also talks about who to call as far as specialty mental health services. And on the back side of it, we had our meetings like every other county who's come up with these, 3-4 pages on, criteria here, criteria there, all this kind of stuff. We wanted something simple because, with so many Medi-Cal members in San Diego County and so many primary care doctors out there, and then they're just telling some receptionist or somebody else to refer them somewhere to mental health. We wanted a simple document to look at. So we came up with a simple document. Basically, you look at this little form, instead of having to look at something that's 2, 3, 4 pages long, if you check something at the top, then just refer them to the county mental health system. If you check something at the bottom, refer them to the health plan. On the front side gives you the health plan's behavioral health system on who to call for stuff like that. Most importantly is there's a no wrong door. There is absolutely no wrong door. You check the wrong box, that person is still going to get in the door. They're going to get the help they need, and they're not going to get it for just one visit just to say, oh, you should have gone to that other door. They're going to get it for a while to really assess and stuff. So, for our health plans, if somebody is really a serious mentally ill person, or SED in the case of a kid, and somebody's checked the bottom half of this and they've referred this person to us and they've called us for help, they're going to get in the door. 6 months down the road or something, we're going to transition them, maybe, we'll see. If they've had multiple hospitalizations, might be an opportunity for them to be discharged to a county mental health run program where they'll get a little bit more intensive treatment like case management, things we might not do besides a weekly therapy or psychiatry visit. They're going to get in the door. The message I'm trying to say is the no wrong door thing really works. It kind of balances out. If we're treating some folks as a health plan that should be treated at the county, and the county is really treating some folks that should be treated by the health plan, it balances out. And at least in San Diego for a year or two, that's what we're going to look at. We're not going to play this ping pong. We're committed to not the back and forth with the members. If they get in one door, they're going to stay there for a while and get the help they need. Another document, I know it's at the end of my presentation. One thing that was very interesting, if you look, there's a tool that says inpatient treatment, Medi-Cal inpatient treatment. I found this very interesting. It took me a while. It was actually because of Kaiser we developed this document. And I had to remember that Kaiser is 2 different things in a way. They're one, and it's really cool. I love Kaiser. But they're 2 different things. They're an HMO, a payer, and they're a provider of care. And it was their new behavioral health director for Kaiser Permanente that was at our table. And I'm so used to working with my health plan partners as a managed care plan in that mindset. And so this person's at the table, and I'm thinking he's just another one of them, and kept asking these questions like, well, I don't know where to refer for inpatient treatment. Well, inpatient treatment's like it's been since July of 1998 when mental health was carved out of the health plans. Nothing's new here, and I was getting so frustrated, and I realized, oh, wait a minute, he's a provider of care. Now, for the first time ever, seeing a Medi-Cal beneficiary, because remember, Medi-Cal was carved out since 1998, went to the county, so a Kaiser Psychiatry and our health plan providers that treated our other, like Healthy Family Kids and our private providers for our Medicare programs and stuff, aren't used to seeing Medi-Cal beneficiaries. So that's why we created this document. I actually like it. It's helped them at least know what hospitals can see somebody, because they really didn't know. They would think, well, if I got a 9-year-old that's really out of control ADHD and breaking windows in the house, I'm going to send him to this hospital, and then it turns out this hospital only treats adults because that provider hadn't dealt with inpatient referrals for so long. So this was a nice document. And any of these documents here, I know this presentation, these documents are at the end. If anybody likes anything, the state of California really likes all of our tools, and they have them posted in places. We encourage you to steal them all. Just put your own logos on them, take pieces of it, but if anything works here, feel free to use it. So again, for Medi-Cal Managed Care, we started focusing hard real quick. We've developed the quick guides, developed separate adult and adolescent screening tools. Those were the other two handouts here. One of them, the one says San Diego County Adult Medi-Cal Mental Health Severity Analysis, and the other one says Children and Youth. They're two different documents. One's landscape. Those are more for what I said we're not going to do. Those are when somebody is in one of our systems receiving behavioral health providers by licensed mental health professionals, and it's time to start thinking, okay, they need to go to this different system appropriately, not just cut them off, but at some point. This would be the tool designed for those licensed people. We're not sharing it that much. All of our county behavioral health providers have this tool. Our Medi-Cal Managed Care Plan providers for mild to moderate mental health conditions probably don't have this tool. I know I haven't sent it out, but I don't think any of us have. And Greg and Sabra's shaking their heads. So we're not really using it on our side again yet, but it is a tool that we developed because everybody's saying we need these tools. So we created tools because they said they needed them. Inpatient treatment guide I talked about, behavioral health plan contact card. I didn't share that with you guys. It has a similar look to this, but what we did for all of our different things, we had them for healthy families. We have them now for Medi-Cal. We've got a separate one for Cal MediConnect. A plan contact card is really a nice tool any county can do that wants to know how to contact your health plan or how to contact your county and have a key person at those places, not just a phone number to call and they're going to answer saying, well, what are you calling about and who are you, what do you do? That doesn't work. You have to know each other really well. So our contact cards says, for Medi-Cal, the 5 different health plans across the top, what our authorization numbers are for medical care, what our member services numbers are, what our pharmacy numbers are, and then somewhere at the bottom, it lists each person at the health plan. So for my health plan, it's got my name and a direct phone number to me. It's not a number to some other folks. It's a number that's managed that will answer, if I'm not there and make sure to get a hold of me or try to solve it. But, the same thing with the county. We've got a high-level person listed on that card, Tabitha Lang, who's our Chief of Quality Improvement at San Diego County Behavioral Health Services. It's not her secretary's phone number or somebody else. It's her direct number. Our mental health advocate, her name and her number's on there. Our county has County Behavioral Health. They administer their behavioral health services for the fee-for-service network, and inpatient treatment and long-term care is administered through their administrative service organization, Optum Health. So it's got the executive director, Ruth Kenselman, of her on that number. So we like that. We share that with all of our providers. We tell them don't pass it out to friends and family. Use it for your upper management folks, that if there is a problem, if there is some barrier for somebody, have somebody you can call. And again, at the bottom there, health plan provider trainings and county behavioral health provider trainings. Like I talked about with Cal MediConnect, we did a whole bunch of trainings around this new benefit, to really make it clear. There was a lot of confusion. We would have early on, we would get phone calls being one of those liaison persons where somebody's come into a county mental health program. They've been going there for years and years and years. They're pissed off at them now for something. Probably has nothing to do with anything they did. But the client's pissed off and says, I have this new benefit. Help me get my health plan. And it's like, well, if they're seriously mentally ill, the client's benefits are going to stay through the county. They're not going to come into the other system and vice versa. But we needed to get out there because the county providers weren't sure how that would work, and they thought, well, we'll just move them on instead of moving them on to another county mental health program for those who are seriously mentally ill. So we got out there and did a lot of trainings and really taught them. We shared all these tools, which has worked out really well. And it's been really great because we've developed all these great relationships. Some of our challenges are important to talk about. Benefits not clearly defined prior to implementation. State of California just wants to is moving everything into Medi-Cal Managed Care one way or another. Again, IHSS, all those programs, it's really something to think about. And I said it early on that I believe down the road all mental health will come back into the health plans. I also believe, and even if I'm the only one that believes this, I believe health plans do such an incredible job with mental health and substance abuse treatment that a lot of you might not realize it because history-wise, we treat a different population, but we have good systems. I mean, I can tell you at my health plan, anybody that calls today that needs a psychiatrist or a therapist gets seen today, if they need to be seen today. We all have networks like that, and we share networks. You know, I get a new provider, I say, Sabra, you won't believe this person. You know, they'll even go to the house. I mean, we just share stuff because we're like that in San Diego County. You know, and so where I was going with this really is the fact that we've got these systems in place. These systems aren't going to work necessarily for somebody who's seriously mentally ill, who's disheveled and constantly being hospitalized, constantly being put on a hold. And we're going to expect them to come into our health plans in our private offices in La Jolla with black leather couches sitting next to a kid, you know, waiting for family therapy. That's not going to work. And so I think the health plans throughout the state need to use this time to really get close like we are in San Diego, so that if mental health comes back to the health plans, you know, health plans aren't saying we don't need the counties, or vice versa, because we actually need each other very much. Our county behavioral health programs, certainly in San Diego County, but I know everywhere else in the state, because I've been lately to enough of these types of presentations, they do an incredible job, and they do a job that we can't necessarily do in many cases. In most cases we can, but there's certain things we can't do. Screening tools not developed by the state, but as we've demonstrated here, San Diego certainly has developed them. Federally qualified health centers, that's been a huge problem in San Diego County, and I'm sure everywhere else. The FQHCs provide services, and they get what's called wraparound dollars, and it's a way of making them equal, where if they don't make enough money here, down the road the federal government makes them equal. It's something called PPS, Sabra? Some kind of payment matching system and stuff. And with this new benefit, it's been a real problem for them because, you know, for the most part, the health plans all decided that we would contract or get into some kind of relationship with them to treat the mild to moderate mental health benefit, this new benefit, but not the seriously mentally ill clients, because that's the responsibility of the county. So now that these FQHCs can't bill our county mental health systems because of some legislation, I don't know what it is, but there's something there, it's creating problems with their reimbursement from the federal government. But that's a problem that every county is having. It's a huge one in San Diego because we have so many wonderful federally qualified health systems, but they're working it out. We're all trying to partner together to help them work it out. We're advocating for them on their behalf. We're not reimbursing them, you know, for this population, but you know, in the meantime, just like everything else we do in our town, they continue to provide the treatment as they should. Health plan network development, this benefit happens so quick. Just like ABA services, and I will have time real quick, I'll talk about, you know, we had to set up systems pretty quick. A lot of us already had pretty strong networks because of healthy families, so it just transitioned to Medi-Cal. SBIRT implementation, screening, brief intervention, referral, and treatment. Hopefully you guys know what that is. It's a new benefit for Medi-Cal Managed Care. It's slowly getting off the ground. I don't think we've done as much as we can. Department of Healthcare Services is doing a really great job at trying to set up webinars and trainings on how primary care doctor sites will do the screening, brief intervention, and referrals, and help link people with our help into the alcohol and drug services covered by the Drug Medi-Cal program. I think we could do more there. Voluntary inpatient detox, that's an interesting new benefit covered through the Alcohol and Drug Services program, through Drug Medi-Cal, but it's done at the state level. That's very confusing. I don't know if you guys have had to deal with it. Basically, Medi-Cal Managed Care Plans have always covered acute medical detox, but that's it, and it's really a medical treatment in a medical facility. And now the state of California, with all these new benefits coming up, like I said before, they decided to create something new, which is VID, Voluntary Inpatient Detox, which is basically the same thing we've been covering since 1998. So we love the idea of it because they can pay for it, but we can't figure out the difference between the two systems. So everywhere in California that we know of, they're struggling with this, you know, and in the meantime, I think health plans are saying, we just cover it when somebody goes in, but it's not like going to a Betty Ford Center, it's in a medical facility, and the same thing with this new benefit through the state will be a medical facility, not like a freestanding psych hospital or a Betty Ford type center. But it's all meant to bring more benefits to Medi-Cal beneficiaries, so we like it. We've had a lot of conversations about who covers psychological testing. Still working on that, so what San Diego said is, well, if the county gets a request for psych testing, they're covering, and if the health plans get a request for psych testing, we're covering it. We don't know the answer to that one yet, but we're working on it. And psychological consultation for SMI and SED members, we're still working out that one. That really has to do with, like, if somebody's in a medical facility and they're really depressed, they're there for medical reasons and they need a consultation, who covers it? Is it the county through the specialty mental health system or the health plan? Right now the health plans are pretty much just approving it on an ongoing basis, and we think that's how it should stay. Same thing if somebody's in a skilled nursing facility, they often need psychological consultation. So health plans are covering that. If during that assessment it's determined somebody has a serious mental illness, they need ongoing specialty mental health services, then when they're discharged, they'll be discharged in that direction. Sample documents. We've gone through all these. This is the Cal MediConnect Behavioral Quick Guide you have. The back side of it is the benefit matrix. This is, you don't have a copy of but this is one of our behavioral health contact card. This is the one that's for Cal MediConnect, and what's not listed here is the one that we hand out to county behavioral health providers, upper management, so that every single program in San Diego has a key contact at each of the health plans. So there's one more little box at the bottom on those. This is our coordination of care form, so I'm glad you have access to this. I talked about it. Feel free to use it. The first part of it is a guideline. The second part of it is the actual coordination of care. This is mandatory in San Diego County. This is the form I said was that we developed back in 1998. We actually stole it from LA. It's been modified. It's been modified by our county behavioral health simply because it had to be a certain font and things like that, things that we hadn't looked at when we first put this together. Health plan said, we don't care what you do to our forms and stuff, just make it get used, and the county started doing it, and I'm so proud of our county behavioral health for that. I'm flipping through. This is our Medi-Cal Quick Guide that you have copies of. The back side of it, where you check the upper box, you refer them to the county. You check the lower box, you refer them to the health plan. The severity analysis. And before I go questions, I'll just throw in there, if I have a couple minutes, about ABA. Have you guys all heard about applied behavioral analysis? Or maybe not, so I won't talk too much about it. The government's decided that they would like to give the health plans a new benefit, which is applied behavioral analysis for kids who have autism spectrum disorder. Goes back to that theme of throwing everything into our health plans, our Medi-Cal Managed Care Plans. So ABA is typically covered by regional centers throughout California. And just 2 years ago, or a year and a half ago, Toby Douglas, the director of Department of Healthcare Services, was standing up here like this in front of a bunch of legislators because autism advocates were really pushing for more ABA coverage. Was saying Medi-Cal Managed Care doesn't cover this, the regional centers do, and they do a good job, end of story. And it kind of stayed that way until just overnight it was decided that the health plans will now cover this. And this is, a wonderful service for kids, but there's a lot of times where it's used where it might not be done. We know of actually, it was we're told, developed for a child that's 0 to 6 years old, and we know of a case where a 71-year-old is receiving ABA services through our local regional center in San Diego. So, that's kind of scary, and this is our new benefit, but it kind of gives a message that things are moving fast and we just have to keep a smile on our face. So that benefit became effective last Monday. Do we have providers for ABA? No. The way the state's looking at it is all those kids, which are mostly 0 to 6 year olds, that are receiving services through the regional center in San Diego County, and the same with every other county in California, the regional center will continue to pay for those services until DHCS and Department of Developmental Services, I think, DDS, will come up with a transition plan to move those kids over to us. And anybody, any age, well, under 21 actually, they set a limit, thank goodness. So anybody else seeking new services or who hadn't gotten it before, who maybe have been denied by regional centers, will now call the Medi-Cal Managed Care Plans to get ABA services. Big challenge, we don't have providers. All of us are working hard to make that happen. It was effective last Monday. My health plan, we haven't had a single call, so I'm knocking wood. I hope the call comes in. It's while I'm standing here.